Hi everyone. Today my presentation is on incarceration and the impact that it has on children. The definition of incarceration is the state of being confined or imprisonment. The purpose of incarceration was to act as a deterrent so that a person would not commit future crimes. Parental incarceration, I learned doing this presentation, is an adverse childhood experience, an ACE, that can be defined as potentially traumatic and a dangerous event that can have a lasting impact on a child's health and well-being. The scope of this issue is, what I've learned is it's pretty extensive. In 2016, 2.3 million people were reported incarcerated. 2.7 million children have at least one parent who is currently incarcerated, and there are 5 million children who have had at least one parent incarcerated in their lifetime. 15 to 20% of those children are in the child welfare system and have an incarcerated parent. 60% of those incarcerated were minorities. In Pennsylvania, which is where I live and sort of where my information is focused, Philadelphia, Pennsylvania, 81,096 children have a parent that is currently incarcerated. The at-risk factors in the population, 1 in 9 children of those incarcerated are African American, 1 in 28 are Hispanic, 1 in 7 children are living in poverty. 25% of those that are incarcerated have a mental health diagnosis. Most are with low education levels are from poverty-stricken neighborhoods. The rate of incarceration is increasing among poorly educated men of color living in poverty. And the 1980 war on drugs created an epidemic of incarceration on the Black community. At-risk factors continuing. Parental incarceration has an effect on children's behavior, their academic studies, and emotional state. Through this presentation and the research, I've learned that children, their behavior in school, they may be aggressive, they may have high anxiety, they may suffer from PTSD, and they should be getting mental health services, and many are not able to. Another at-risk factor is family instability. Children may enter foster care if a parent becomes imprisoned because there are no other caregivers identified. This is especially high when moms are sent to prison. They're not able to find a family member, a grandmother, a grandfather, aunt or an uncle to care for the child. There's also a shame and stigma attached to having a family member incarcerated, and it could cause some problems within the family. And then those family members may also suffer disenfranchised grief, which we have learned previously that it's a kind of a grief that is not recognized by society. It's not necessarily the death of a loved one. It's, the person's in prison. It's not something that people want to brag about or people want to talk about necessarily. So those that have family members and children who are in prison, they don't necessarily like to talk about it because they're kind of embarrassed. Also, another at-risk factor is an economic hardship. So if a parent becomes in prison, if they did have a job, there's a loss of that income. Their legal fees also create financial strain on caregivers, and then also to care for the children of those incarcerated. It's another mouth to feed, it's somebody else to dress, to take to doctor's appointments and things like that, and it could cause financial strain if those family members are not guided to access any services that are available to them. So the first prison was the Eastern State Penitentiary in Philadelphia, which is where I live. This was built by Quakers who believed in solitary confinement. They thought the person should be by themselves to think about what they've done and to repent. And as a sidebar, those of you who are familiar, they do every year. You can still tour the Eastern State Penitentiary several times a year. They have different events. The big one is Halloween, but you can still tour the Eastern State Penitentiary if you wanted to. During the late 1800s, prison reform became about because the reformers thought that the people who were in prison were there because of their life circumstances. They were either stealing food or stealing things to help their family out. It's not necessarily because they wanted to break the law, but they needed to help their family or themselves. Women's prisons and juvenile justice prisons were created in the late 19th and early 20th century. And then another history fact is incarcerations rose in the 80s and 90s. Actually, they were less focused on reform and more focused on punishment due to changes in policies. So some of the services, again, I focused on Pennsylvania and Philadelphia because that's where I am. So we have the Department of Human Services, which offers a wide range of all kinds of services, but for specifically for this population, DHS offers parenting classes for either mother or father who are incarcerated. The Curran Fromhold Correctional Facility and Riverside Correctional Facilities are both located in Philadelphia. But you do not necessarily have to be involved with DHS to take advantage of those parenting classes. And again, the goal is to improve those parenting skills, to reduce the rate of recidivism, and so that those moms and dads have a more successful transition once they do return home to their families. And the number on there is listed if you wanted to register a patient, a client, a family member. The Pennsylvania Prison Society also is available, and they help families get to the actual prisons. Many times the location of these facilities is a hindrance, and children and families are not able to because they're hours away. They don't have any transportation access. They don't have the financial means to do that. So the Pennsylvania Prison Society offers financial assistance so the family members can stay in touch with their family who are incarcerated and keep that line of communication open. So on a micro level, children of incarcerated parents, as social workers, we would want to make sure their basic needs are met, that they are in a stable household, and that they are able to visit their parent in prison. I would also help and encourage the child to, write letters to their parents. I know kids today, letter writing is kind of like an anomaly, and it's a lost art. However, I think it's important for them. Some kids don't like to actually talk, or, when they're face-to-face with parents, they may have things to say. So a letter writing may be a way for them to get out their feelings and talk about how, what's going on with them and, let their parent know how they feel. On a meso level, I think teachers and administrators need to be educated on the impact of parental prison on the children they are teaching. Children may be acting out. Children may be responding to events that are happening in ways that you may not understand, but if you don't know that there are family members in prison, it's helpful to be educated for that. Also, making resources available, mental health resources, therapy, counseling, making those things available in school. Even if they want to have individual, letting them know that there are staff available to help them. And then for prisons, creating more opportunities for education and learning a trade while in prison, making it a more productive time while they are there to learn a trade so that they can be employable once they are released. And this will then hopefully reduce financial strain, and other positive things would follow. On a macro level, I think there needs to be more focus and research on the racial disparities in the prison system, and there needs to be prison reform to address those, especially for nonviolent offenders. And we've kind of been hearing a lot more about this in the last few years, with the Black Lives Movement and police reform. So I think a lot of changes hopefully will be coming on the meso and macro level for that. So I hope you enjoyed my presentation. I welcome any and all feedback, and thank you all and have a great holiday.